When you do closures, remember the tissue layers, which include the epidermis, which is at the very top. Dermis is below. Subcutaneous fat tissue is below that. And then later tissue layers are the fascia, muscle, and then bone is underneath that. So skin closures, the most simple one is called the simple closure. And what you're going to do is you want to evert your edges when you do that, so that when your sutures are coming together, you want your tissues to start open, and then you tie it and they roll close so that the edges come together. So a little bit of a fish mouth look. When you put the suture in, when you tie it, it should close this way. If you get too close to the edges and you tie it, then you're going to roll the edges under. And that's not good. Then the tissue can't heal very well, and you may have a funny looking scar. So when you do this, we recommend that you evert the edge. And again, I'm going to use the tine underneath the skin, so I'm not grasping it. And I'm going to use that curvature, come through. Okay, I can do this in one pass or two passes, depending on how good the tissue sits. So here's my first pass. Pull that through. Reload, and then I can evert the other side, push that through, and again I'm going to use my forceps not to grasp but to stabilize, have that come through, and I can reload, and then here's my simple suture. So if I tied this at this point, I'm going to go over knot tying in a little bit, then I can bring my edges together. Okay, so that's a simple suture. Again, evert your edges. Try to make the fish mouth, and when you tie it, the fish mouth closes. Another one is called a vertical mattress suture, and there's a couple different ways we do this. Usually you don't do mattress sutures unless you have bad tissue underneath, like the subcutaneous tissue, and you need more strength in the skin. One of them is called the near, far, far, near. So first one is you evert the edge, you come near the edge. Again, if you can do this in one pass versus two, that's fine. This forceps is kind of big on the teeth, so it's a little hard to grasp. Let's just do it this way. So that's near. And then far would be you're quite a bit further away from the edge of the tissue. Again, you can do that, grab it, reset it. Sorry, mismatch of the teeth here. Okay, so that's near, that's far, and then you do far. And then the last part would be the near. Okay, so your near suture to far, then you go far to near. You tie this together. It brings the skin together, and you see that long bridge, which is away from the edge of the skin, and that helps reinforce the repair without putting a lot of damage or tension on the actual edge of the wound itself. So that's the near, far, far, near. And then there's another one called the far, far, near, near. So you can go farther away. Again, I don't like to grasp the tissue if I don't have to. Here's your far, grab that. So again, pretty far away from this edge. You're gonna come underneath and use your forceps as stabilizer. Here's our far. Let's try that again. That happens. You can pull your sutures out, get caught on something, it's fine. Just start again. Nothing to worry about. Here's my 2 fars. Now I'm going to reverse the needle in my holder. And this is something that you probably want to practice, is reversing. So you're going from a supination to a pronation motion, again, using the curvature of the needle. So I can go for the near. Okay. And then the other near. So far, far, near, near. So the configuration's a little different. So I have a far to a far and a near to a near. And when we tie this, now your suture bridge is all away from the actual edge of the wound, okay? So that's the far, far, near, near. Another orientation that you can learn called a horizontal mattress. Basically, you're going to have your passes. Let's make this a little bit closer. So I've got that's a single pass, and I went through both sides of the tissue. And again, you reverse the needle, and you come across next to it. And the pattern of where you put the sutures depends on the tissue requirements. So that's a single pass, come through. And if I tie that down, right, then that's going to bring the edges closer together. And again, your knot is going to be away from the edge of the wound itself. So that's the horizontal closure. Knot tying with an instrument and knot tying without an instrument or using your hand is going to be a little bit different. So let's go over knot tying with an instrument. There are different ways to do this, but the simple way is to have past your suture. It's better to have a short tail. You put your instrument in the middle, you wind it around, going over it and around, and you grasp the other end, and then you pull it through. And that's what we call a half hitch. Now, if you have a situation where the tissue is a little bit springy, a little more tension, you can do this twice. Grab it, pull it down. And this is what we refer to as a surgeon's knot. Okay, you want to lay it down flat, hands go across so that the strands are pulling it in a flat knot. Once you do that, you bring your instrument in the middle again. Now you're going to take your suture, come around it the opposite direction, grab your tail. Now you're going to cross your hands in the opposite direction so that, again, your knot lays flat, okay? Put it in the middle, over and around, grab your tail, lay it down flat in the opposite direction, put it in the middle, grab your tail, hands go in the opposite direction, okay? So that's a surgeon's knot. Now, you can do what we call a sliding knot. So when you do a sliding knot, same setup, suture is passed, come around one throw. If you do a surgeon knot, it's not going to slide. You're going to come down, lay it down flat. Then you're going to come around the same direction, grab it, slide it down. Now, theoretically, this can slide. See that? So it can slide. And the reason you do that is because once you pull it, you can keep a position, but you still have flexibility to tighten the suture afterwards. So now you can cross it and then go the opposite direction. This is now going to lock the knot, but it slides a little bit as you do so. So it was sliding If I pull back on this now, it holds its position better. Because it's a monofilament, I can make it slide a little bit. If I were using a Vicryl, it would not slide nearly as much, so it's a little bit more stable. Again, come in the middle, come around, grab your tail, go the opposite direction. Come in the middle, come around, the opposite direction. So this is how you tie your instrument knots. Middle, around, cross, middle, around, cross. You can just do this, and if you have the instruments, and just keep practicing so you remember the pattern. And just have a routine, okay? So that's how you do an instrument tying. For hand tying, same principles apply. Pass your suture, have your hand on the different strands. And for a two-handed knot, you're gonna use your left hand, if you're a right-handed person, as your beginning. So you're gonna set this where you're gonna create a loop with your thumb. Make the loop, hold with your second finger. Bring your right hand around with the free strand. Grab it between your fingers and rotate it through. Grab it on the other side. There's your half hitch. Then you do the opposite. Now you use your second finger, create a loop. Grab it with your thumb. You're going to use your second finger, push that through, and catch it on this side. And if I can do that. So there it is in the middle. Easier said than done. There it is. Okay, so now I've got that. Now you notice my hand's going to cross and go the other direction. Okay, so thumb, create a loop, pinch your finger through, thumb through. Make my hands level. And then the opposite, second finger, create a loop, thumb, use your second finger to bring this through the middle, grab it on this side, and now your hand's gonna go the opposite direction. Okay, so again, keep practicing. Thumb, loop, second finger, thumb pushes through, come this way. Second finger, thumb, create a loop, use your second finger, bring it through, and then come this way. Okay, and as you get more familiar with it, you can go a little faster maybe. Okay, so this is something, again, notice I'm wearing gloves for these. It adds that element of realism. Since you're going to have to do this with gloves anyway, you might as well practice with gloves on. Okay, so that's enough of that. One hand tying of knots. You basically have your free end on one side, and you're going to hold what we call a post on the other side. Okay, so now you want to have enough length in your free end to be able to move your hand. Okay, so you're going to go both over and under, just like you did with the knot tying. When you have a free strand, the under comes in where you create your loop here, second finger, come across, use your thumb to roll it through, and then you're going to roll that suture through there, catch it on the other side. You lay it down. So now the second throw is a little bit different. You're going to put your hand in the middle, come around the side. Okay, your fourth finger holds the loop, third finger pulls, you grasp, pull through. And there's your second part of the loop. So the first part again, second finger, you're holding it with your thumb and third finger. Okay, you're going to come around, pull towards you, use the back of your finger to get that free end, pull it through. There's your loop. Okay, and you pull it down, hold the end of it, 2 fingers through, 3 and 4, come around, pull your third finger, grasp it with the third and fourth, pull it through, cinch it down. Okay, so again, holding 1 and 3, 2 is underneath, cross it, back to the finger, pulls your free strand, let go, pull it through, hold it with 1 and 2, 3 and 4 come through, suture comes around, use your third and fourth, pinch it, pull it through, so you can keep practicing this. So again, 1 and 3, 2 is up, come around, use the back of 2, pull it through, grab it 1 and 2, 3 and 4 come around, cross it, use your third finger, third and fourth hold it, pull it through. So just keep practicing that. Okay. Cutting may be simple in concept, but there is a right way to do this. When a person is done tying the knot, they should present the knot with both strands straight up so that the knot is easily seen. Both strands are out of the way. That can be done with their hands or in this case with the instrument. When you do a cutting of a suture, you want to make sure that you just don't come at it. Okay, half the time you're going to miss. Sometimes you'll actually cut out the knot. That person has to start all over again. Okay, so what we want you to do is take your open blade, slide it down so you touch the knot. In most cases, you can actually feel a little resistance when you hit the top of the knot. What you don't necessarily want to do in all cases is to just cut it. If you cut it directly at the knot, some of the sutures, particularly the monofilaments, may actually slip out a loop or two, and then you lose the effectiveness of the knot. In that case, you want to make sure you have what we call a tail. So a tail can be short or long. If you want to have a long tail, say you're doing a deep closure in the fascial layer or a tendon layer, and you don't want that to unravel at all, you may want to give a good 2 or 3 millimeter tail and cut it this length. If you're near the skin in a subcuticular layer, particularly at the subcutaneous or subcuticular layers, you don't want the tail sticking out of the skin. So what we ask you to do is slide down to the knot, rotate it about 45 degrees, and then cut it. So that way it's not directly at the knot. There is a little bit of a tail, enough so that the last throw or half hitch of the knot is not going to slip through automatically. So when you cut that, again, you're going to push a little bit with that thumb, and you want to cut it and leave just a smidge of a tail so that that knot doesn't unravel.